Good evening and welcome to Your Health Matters OC. This is our holiday edition, and I'm Jenna Sarin, the Orange County Healthcare Agency's Chief Nursing Officer, co-hosting tonight with Dr. Regina Chincio Kwong, better known as Dr. CK, our County Health Officer. Today we're going to be talking about something we can all certainly relate to, mental health wellness during the holidays. And as we know, the holidays can certainly be a joy-filled season, but they can also be really stressful and certainly bring some challenging times. I'd like to introduce our special guest, Dina Helmy. And Dina is a licensed marriage family therapist with the Healthcare Agency's Mental Health and Recovery Services. Dina, thank you so much for being here with us this evening. But before we get started on our topic, Dr. CK, we want to turn things over to you and ask if you can start with a brief update on what's happening with the winter virus surge that we're experiencing within our community.
I feel like this is supposed to be a joyous type of video celebrating holidays, and unfortunately I have bad news about the winter surge that we're experiencing. Unfortunately, our COVID case rates are increasing. We're at 6.8 per 100,000. And we are now seeing also a rise in case positivity, which is now 6.8. Our hospitalization rates are also going up. We're now at 203 that required hospitalization with COVID, and 32 in the ICU for COVID. And along with this, there's flu and as well as RSV. So, it's so important for people to protect themselves and their loved ones by, one, wearing a mask when you're around others, or you're in crowded situations, or when you're indoors, or when you've been recently exposed and are trying to protect others from yourself, and get vaccinated. There are boosters and bivalent boosters for COVID-19 that are available. There's also flu vaccines that are available. Unfortunately, our pediatric population is still the least vaccinated. So parents out there who are listening, please get your little ones vaccinated because it will help protect them against severe illness. And we do have COVID vaccines that are now authorized for those who are 5 and up to receive the primary series of a very effective vaccine, mRNA vaccine, as well as the updated booster. So as you can see on this table, as long as it's been 2 months since completing your primary series, you're actually, as long as you're 5 and up, are eligible for a updated booster that covers Omicron variants. So this actually helps reduce hospitalizations from COVID-19, so please go get your boosters. Additionally, if you haven't gotten your flu vaccine yet, please get your flu vaccine. It's recommended for those who are 6 months and up. And if you're 65 years or older, there are 3 special formulated flu vaccines that are available that can really help protect you. So go to your local pharmacy to get a vaccine. What we're hearing from hospitals is that people who are coming in sick are coming in with either RSV, flu, or COVID. And for those coming in with flu or COVID, it's typically someone who is not fully vaccinated. Or for flu, someone who's not received a flu vaccine yet for the season. So please go get your flu vaccine. And even if you have gotten your vaccine, just realize it takes about 2 weeks for the immunity to really boost up. So please also wear a mask. I know that people think that now that I'm vaccinated, I'm fully protected. It protects you against severe illness. It may not protect you fully against infection, but at least against severe illness and the consequence of severe illness. So still very important to get your vaccines. As far as COVID, if you have symptoms of upper respiratory stuff, you've got a headache, you're fatigued, you've got a stuffy nose, sore throat, consider seeing a provider, consider getting that COVID test. So there's new evidence showing that if you get treated early on in your illness of COVID, you can actually prevent or reduce the potential for long COVID symptoms. And you can get back to living your regular life, right? You can get back to your activities sooner. So please go seek treatment if you actually happen to have COVID. And again, isolate, rest and recover when you're isolating, and talk to your provider. And there's more, there's wider eligibility criteria now since Paxlovid is now more widely available. So if you're 50 and older, honestly, please go seek treatment. Paxlovid is available widely, but if you have chronic conditions, again, it's best to go to your primary care provider, because you may be taking medications that the provider has to be a little bit more careful with when prescribing Paxlovid. And again, there's other medications also for those who are 12 and up. So please seek treatment or consider seeing your provider to see if there's any treatment options for you. If you have the flu, there's also treatment options that can help prevent severe illness. So again, those two illnesses have treatments that are available. This is why we have now telehealth services, primary care services, urgent cares. Please go get care. Now, if you have significant symptoms, you're having difficulty breathing, your child looks really dehydrated, is not with it, these are the reasons to go to an emergency room. And we know the emergency rooms are really packed right now. So even if you're in the emergency room, you can actually go on a telehealth visit to see if they can help expedite and triage you that way. Our hospitals are doing everything they can to service anyone who's seeking care, but just be mindful that it may take a while to get seen in the emergency rooms. What else do I have? Any other questions about all the things circulating? So RSV, I know we do have an RSV, we do have a state of health emergency here in Orange County as it relates to respiratory illnesses, and more specifically RSV, since it caused a lot of hospitalizations for our children. Our pediatric hospitals are still full and at capacity when it comes to treating children, but that should not prevent anyone from going to the hospital if their child needs care. Again, our hospitals are trying everything they can to make sure that they can care for anyone who is seeking treatment or evaluation. Our emergency rooms are also hitting record-breaking visits daily, and that includes even our adult hospitals. Recently at the Board of Supervisor meeting, one of the emergency department directors talked about how they actually saw a record number of emergency department visits this week compared to the whole entire COVID. So obviously our adult hospitals are also being impacted by the surge of respiratory illnesses that are affecting many. And we continue to anticipate higher numbers and volumes, unfortunately, because we know that everybody just gathered. So again, do what you can to protect yourself and your family. Take the appropriate precautions. Wear a mask when you're indoors in public spaces. Stay home if you are sick. Wash your hands frequently. Cover your cough or your sneeze, or cough into your elbow instead of your hand, so you're not shaking people's hands and spreading germs. And get vaccinated for flu and COVID-19. With that, we'll move on to the topic we're supposed to be talking about.
Great. Well, thank you so much, Dr. CK. And I think, it's such an important opportunity to, as we bridge tonight's topic, to realize that with illness and things going on in the community, when people are overstressed and their immunities are down, it also can heighten, their ability to get sick. So I think all of this is going to feed right into what we're talking about this evening. And before we jump into our topic, I just wanted to remind our viewers that please, if you have any questions tonight about anything Dr. CK has talked about, or certainly as we get into the topic, please email us at yourhealthmatters@ochca.com. Again, that's yourhealthmatters@ochca.com, and we're happy to answer your questions. So with this, I know that, we wanted to focus tonight on the importance, really, of how stress can impact health, and really how to be mindful of health during the holidays. So Dina, in looking at tonight's topic and some of the things that we wanted to talk about, what are a couple of things that viewers can expect might be triggers for stress during the holidays?
Okay, thank you for that. So the holidays are going to bring with them different types of stress. One of them is this idea of having to overdo everything, having to make sure that everything is perfect, make sure that we're seeing everyone. Also, it can bring with it a sense of grief. If someone has lost a loved one during the holiday season, can trigger some of those feelings. And we know that during the holidays, people are gathering, and a lot of times those gatherings involve substances. And so it can be triggering for those who may be in recovery.
Yeah, and all such important points, right? Because, we've always talked about how the holidays bring so much joy, and yet for so many people, all of these different kinds of triggers and things, some being, circumstantially imposed, some being self-imposed just because of the pressure and stress that individuals put on each other and on themselves as well. So before we talk a little bit more about this and we dig into some of these details, we do want to show a short video on how not to overdo things this holiday season. So please join us with this video.
Twinkling lights, gift giving, excessive amounts of baking. It's the most wonderful time of the year, right? Well, not so fast. For many people, the holiday season can bring on feelings of despair and loneliness. While holiday depression is not an official clinical diagnosis, the holiday season is full of potential depression triggers. Let's dive in. Here are the 6 tips to help avoid holiday depression. We spoke with Dr. Gail Saltz, an associate professor of psychiatry at the New York Presbyterian Hospital, Weill Cornell School of Medicine, and host of Personalogy podcast from iHeartRadio.
There are a lot of stressors around the holidays, and therefore your mood is brought low by constant stress. Or it may be that you're in the group of people that tends to feel depressed every year at this time of year. And probably that depression is more related to the season than the holiday, meaning you might have a seasonal affective disorder, which is related to wintertime and the shorter days and therefore the lack of light. It's important to know the difference between holiday depression that has to do with the stressors of the holiday and seasonal affective disorder, because you would treat them differently.
Number 1, make plans ahead of time. Spend some time figuring out how to take care of yourself during this time. Come up with restorative routines such as reading a book or napping, and write them on a calendar. In between shopping and baking, make sure these routines don't fall by the wayside. Figure out some basic, easy practices that can help you through the holidays and make them a priority. Number 2, avoid family conflict as much as possible. Easier said than done, right? Well, there are a couple of ways to save your sanity at family gatherings.
Lowering expectations, being more realistic about the relationship, getting out in front of the relationship before it's the holiday time and talking about the things that you're struggling with that person to see what can be worked out or what you can agree to disagree on. Talking about it beforehand instead of waiting till it's the holiday and you feel worse and the stakes feel higher and it's potentially more explosive is definitely important to do.
Number 3, get enough sleep. Holiday activities can easily interfere with your sleep schedule, but studies have shown there's a link between sleep loss and depression, so you need to be extra careful about cutting back on sleep to get everything done.
This is a time of year when many people drink more alcohol because it feels like it goes with the holiday, and they might Zoom drink. Alcohol also people end up using to go to sleep at night. And while it's true that it will help you fall asleep, it actually causes nighttime interruptions in sleep. So it causes many awakenings that you may or may not be aware of at night, but it will leave you less rested. It actually basically interrupts your sleep architecture. So you're not getting the normal amount of the truly restful part of sleep. And that will leave you feeling not well the next day, which can add to a low mood and high stress.
Try to get to bed and wake up at approximately the same time every day. Avoid large meals and physical activity within a few hours of bedtime, and make your bedroom a sleep sanctuary, free from TV or other distractions, according to the Centers for Disease Control and Prevention. Number 4, limit media consumption. Let's be real, the holidays can make you feel lonely. Advertising campaigns showing happy couples and family units can really do a number on you if you're depressed. Social media and other types of media can often emphasize feelings of loneliness, which is why you need to be mindful of how much said media you're consuming. If you get sad when you log onto Facebook, pay attention to that feeling and consider changing your media consumption habits. You can do this by making a plan. Most smartphones now have screen timers that track usage and allow you to set daily limits on apps. Use these to help cut back on social media use, and you may just find your mood improving. Number 5, make exercise a priority. Exercise is one of the first activities to get lost in the holiday shuffle as our to-do list grows. But its positive effects on mood mean you should be adding this to the top of your list. Maybe even put a star next to it. Taking a brisk walk for just 35 minutes 5 days a week, or 60 minutes 3 times a week, can do the trick to help improve your mood. Number 6, focus on what really matters. The holidays shouldn't be all about the presents, but the financial woes can make it easy to lose sight of that. Rein in the stress and cost by organizing a gift exchange with friends or family, or see if everyone would participate in a group donation to the less fortunate. You can also bake your gifts or create traditions like a family nature walk or board games by the fire. By putting the focus on simple things that spread joy to others, you can relieve some of your own stress and maybe even beat the holiday blues.
Great. Well, thank you, and I hope you all enjoyed the video. There were certainly some great tips that were shared in there. So, Dina, let's discuss some of these strategies just overall from your expertise. What can you share with our viewers on some of the topics highlighted in the video?
So one of the things around the holidays, I know earlier we were just talking about how we're coming off of Black Friday and Cyber Monday and all of these things. There's this idea of having to buy a lot of gifts. And especially around the holidays, this can put an additional burden on a lot of families, especially those who may be struggling, with employment or maybe having different challenges where they're not able to necessarily budget out, what all the commercials and advertisements are telling us that we need to have the latest and greatest of everything. So being aware of how much stress that this can cause the family, and one of the things is finding other ways instead of having to purchase a lot of gifts. What if we went back and redefined the idea of gift giving, where we can still create some symbolic, meaningful memories and share of that with people? I mean, if I were to ask you even right now, what are some of the most meaningful gifts that you've ever received?
They were usually handmade, right? Or there was something special or symbolic about the gift that made it special. And that's what I remember. Yeah. So I know that when I was overseas, one of the gifts that I remember was the girls had made these little necklaces. And to this day, I just keep it. While it was still together, I would wear it almost every day here at Orange County Healthcare Agency. Unfortunately, it broke, but that is more meaningful than something that's purchased and doesn't cost much.
Yeah. And I think for me, because as you all know from our show a few weeks ago, I don't have cooking skills, and I actually I'm not very talented with crafts either, but I think it's the gift of time, right? Mm-hmm. And it's understanding that this time of year we all just get so busy, but my husband and I have a college-age son, and so when the kids are off from school break, for those that might have younger kids in school, or college kids coming home, or other situations of family that maybe come from far or that are close by that you don't get to spend as much time with, I just think to get together and share an activity or share a meal or just have conversation are things that make the holidays memorable, because inevitably funny stories, come up about the past and things that you may not talk about on just a regular dinner. It's a time to reminisce, right, a little bit. So I think those are all really nice ways too that families can do those kinds of things. And like CK said, sometimes it's a gesture. It's making something for someone that shows their gift of time. And I think these things can be really meaningful moving forward and not break the bank, so to speak, right?
Yeah, and it's creating new traditions. So I know for, kind of speaking into the cooking piece, a lot of times there's a lot of stress that gets added because we have to have all these family gatherings, or we have to invite all these people, and it's event to event to event to event. And sometimes we don't take time for ourselves to decompress afterwards. So we're just on go, 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 and being able to pause a little bit. And, we just had this long weekend, Thursday, Friday, Saturday, Sunday. For some people, they might have had gatherings happening every single day and then have to show up to work on Monday. And it's like, okay, was there that time to just be able to step back and reground, recenter ourselves?
Yeah, and I think like we were, talking about earlier too, the importance this time of year, because there's a few things that happen, right? You have the situation of the fun things and the gatherings, but for many people too that are in a work environment, it might be year-end deadlines and things that come up. So sometimes it's the ability to be able to say, hey, I really want to get together, or let's do this, but let's do it in the new year. So people giving themselves that permission, like we were saying too, to not overcommit and add more stress to themselves, right?
And that's overcommitting, like even with social stuff, but as you mentioned with work, there's something about wanting to finish everything by December 31st. And the new year starting and wanting to start fresh, as if we become a different person when the clock ticks midnight. And that's not necessarily the case. And so being able to prioritize and really set realistic goals also, even for work, in terms of like, some deadlines we can't avoid, but are there certain projects that maybe we stagger them a little bit and reduce some of that stress from our lives? Because if we're stressed at work, chances are we're taking that stress with us, and it's finding its way into our homes.
Yeah. Dr. CK, I know in the video, they were talking about the opportunity and the assurance that people are making an effort to eat healthier, right, and get a lot of rest. And I see that sitting here in front of us, it looks like a carryover of our food show, but I'd love for you to be able to tell the viewers what we have here as a means of follow-up to the video with some additional healthy eating tips.
Yes, so it looks like we have a pear here, and then an Asian pear actually, and then there's a persimmon. So I think originally we were going to talk about pears because in certain cultures, pears are symbolic of the new year and of December, and pears are actually a great source of fiber. A medium-sized pear, which I would consider this a large-sized pear, actually has about 23% of the daily fiber intake for females. So if you eat 3 or 4 of these, you might actually hit your fiber intake for the day. It also has a lot of water content, has some vitamin C. So again, great things to think about. And actually eating fruits and vegetables that are fresh also help your mental well-being. Blueberries are great too, but again, you want to eat with the season, and apparently pears are seasonal with winter. There's so many ways to eat it too. We can eat it fresh, we can eat it roasted. You just put some nuts over it. It actually is really good.
I wonder if you could do it in an air fryer, CK.
You probably can. You probably can.
We have this ongoing air fryer dialogue, so I'm thinking that may be an option, right?
Now, right?
Air fryer simplifies my life because I can eat healthy. My husband doesn't have to over prepare. It's fix it and forget it. So usually we'll throw in like some salmon or even some chicken wings or drumsticks. And while that's cooking, we get our salad together. And that's our meal. Within less than half an hour, we've got a meal set. And during this time, we can talk. We're not straining in the kitchen. And so it actually, simplifying your life is so important, especially around this time.
Yeah.
Right?
Yeah.
And I love the discussion about sleep. If people know me, my personal life, I love sleeping. I like to also sleep when I need to recharge because it re-energizes me. So it's also very important to sleep. Helps you reset. It's great for your immune system. But oversleeping is not a good thing, right?
Yeah.
So some people who are depressed sometimes will oversleep, and so you need to check in with your loved ones if they're sleeping more than 10 hours a day, because they're probably depressed or have something else going on that needs to be looked at.
Yeah. So on that note, let's go ahead and take a quick break to view our next video. I think that segues us into the next topic, which, certainly value the expertise that you can share with us on this, Dina, because we know that holidays can often trigger mental health issues and grief. So we have a news article here that talks about managing stress and sadness during the holidays. And when we come back from the video, I think there's quite a bit to unpack on those types of things too, to help people, raise awareness, as well as hopefully we can share some tips on what individuals can maybe do to be able to combat some of those feelings that they're having. So please join us here for the next video.
Experiencing grief during the holidays is incredibly common. When you're still grieving the loss of a loved one, you can experience a wide range of feelings. Some of those feelings and emotions can include sadness, the sadness that's associated with them no longer being physically present with you. There could also be some anger, being very angry that they're not there, feeling angry that perhaps you should have done something to save them, or angry about the circumstances that led to their death. If there were activities that you used to engage in with that person who's no longer here, such as baking cookies during the holidays, perhaps do that as a way to remember that person, as a way to celebrate that person. The other thing to do, especially during the holiday times, is to set boundaries. If you notice that you're experiencing a heightened state of anxiety or sadness and anger, thinking about being around certain people, then I would suggest avoid those situations. Oftentimes as people, as friends, as loved ones, we go straight into problem-solving mode, and we identify a long list of things that the person who lost someone should do, what they shouldn't do, where they should go. But I recommend and suggest that people just be there for the individual who lost someone, to be a listening ear, to be supportive.
Great. Welcome back to Your Health Matters OC. And if you're just joining us, tonight we're talking about managing holiday stress. And certainly the video we just saw captures a lot about mental health issues, loneliness, loss, and stress that all seem to be amplified during the holidays. Dr. CK, can you talk a little bit about why we think this happens during the holidays and what we think that viewers might be able to do both physically and emotionally around the health matters, the physical health pieces, before we talk a little bit more about the mental health?
So there's many different reasons. Depression can also, aside from having triggers of loneliness or of grief, there's also light in certain areas, not California, but certain other areas, there's less daylight, and so that can really significantly impact someone to have them get more of a seasonal depression. So it's important for those people to get regular daylight exposure, and just being outside is so helpful, right? It's so rejuvenating for many of us. But aside from that, there's also so many triggers. There's so much pressure that we were talking about with the holidays, finances, but also when you lose someone who was special to you, you remember possibly all the fun times or the holiday seasons with that person, and so when you have to go through the holidays without that person, that can really re-trigger a lot of grief. So this is a time where if you did lose someone, it's really important for you to be graceful with yourself, to really take care of yourself, and also be patient with yourself. If you're going to grieve and you're going to feel sad, also accept that. Allow that to happen, but hopefully follow it up with something to reconnect with someone, to get out and get active, get some exercise in, because we know exercise also boosts some of the good, healthy neurotransmitters of the brain, and they just get your blood flowing. get into some activities, reduce the substance use, because the substances that you use can actually get you in a deeper depression, can get you more into that grief pattern. They can reduce the neurotransmitters that make you happy, and then just catch you in a bad cycle.
Yeah. Thank you. I think that's like really important for all of us to think about, on the health aspects. And, Dina, from your experience and your work, what are maybe some tips for raising awareness, or some of these, they talked a little bit about boundary setting, right, in the video, and what does that mean? And as far as just kind of the mental health depression aspects, and then we could talk maybe a little bit more, deep dive a little bit more into the grief aspects, because I think that's so important as well.
And so you're talking about setting boundaries and what that can look like. So in this, oftentimes we're so accustomed, like we said earlier, we're constantly on the go. It's the holidays. We may feel that everyone is supposed to be happy, and we're supposed to be together, and we're supposed to put on a certain image, because that's what's expected of us, right? At the same time, though, we need to honor what it is that we're experiencing. And so similar to what you said, Dr. CK, being able to identify, we know that if we're able to identify and name an emotion, we're able to tame it. Like Dr. Dan Siegel does the whole name it to tame it. If we can identify, if we can express what it is that we're feeling, and we can label it, then our brain automatically goes into trying to find ways to solve it. It's a nice problem-solving mechanism that we have.
Yeah.
So being able to find ways to connect with people. At the same time, though, if we're in overload and we're constantly having all these expectations placed on us, we need to be able to set a boundary in terms of saying no. We need to be able to know what it is that what we can tolerate and what our limits are, so that way, if we need to, turn down a certain social gathering, then we're able to. If we're able to turn down a substance or a drink that's offered to us, if that's not something that we want to do, not caving into social pressures, because a lot of times if we're around a lot of people, we want to fit in, and that's part of the human experience.
I think we also need to know and understand if someone lost someone through the year, to understand where they are with their grief, and to be able to name and tame the emotion or the triggers that they may have. So being a good friend, being a good relative would be checking in with that person. Hey, I know you just lost someone who is really special to you. What can we do to make sure that you're taking care of this holiday? We don't want to re-trigger anything for that person, but we want to support them, especially during their time of loss and grief.
And there's a part of understanding. So sometimes a person won't even know. For example, like I've worked with people where they'll start feeling a little bit off, not really knowing what's going on. Everything at work seems the same. Everything at home seems the same, and just something's off. And then all of a sudden, it's like it'll be that day, and they'll wake up and they'll realize that, like, oh, this is the day that I lost, a special person to me. And it's interesting that our bodies know before we're even aware. So if we're able to tap into and have that awareness, then take that as cues for ourselves. Just kind of pausing and practicing that grace with ourselves.
One of the I've done work in hospice and palliative care for many years, and it's a passion of mine. And one of the most meaningful and incredible things that I have seen in these organizations over the years is usually around, the holiday times. They will gather families, both past and present, families that might be dealing with an ailing loved one, people that have lost loved ones, but they bring everybody together and invite them. Of course, it's choice if they choose to attend, but it's really a ceremony kind of in memory of it, and a celebration, right? So it's helping them to rechannel some of that grief into sharing with others with like experience, special things about their loved ones. And I've seen that done. The other thing that, in looking at other ways to kind of honor those that have passed. And again, taking that energy or the hurt or the sadness and, whatever holiday someone celebrates, whether it's a trinket or if it is, a tree that they're decorating or something, having a memento that reminds them of that person, so that while there obviously could be some pain associated with that, it also helps to kind of channel that memory into something positive and really a way of honoring, right, those individuals. So these are some things. Anything else that either of you can think about as far as for our viewers on ways that they might be able to kind of turn some of what they're dealing with, and even though there may be hurt associated with that, but into a celebration, really a celebration of the individual's life and their contributions?
I mean, I know we've had a family friend who recently lost her father, and it was Thanksgiving, and this was the first Thanksgiving without him. And she was sharing that, he was always the one who made the turkey every year. And so this year it was hard, but they wanted to honor him by continuing that tradition. And so they held a whole, almost a ceremony, if you will. So they made the turkey, and in that moment it was also reflecting on the memories and just the contributions that her father had on everyone there. So he was almost, in a way, in spirit with them, and that memory stayed alive, and they were honoring him through continuing to
it's really
keep his,
special, right? Yeah.
And sometimes we lose loved ones from illness, right? And so sometimes, to turn the tide of sadness and grief, you may want to consider that illness and giving back to the community. So maybe, so if someone had cancer and passed away from cancer, there's a lot of activities that the American Cancer Society puts on, or you can even visit someone who has cancer to kind of give support to that family, or maybe even write, a card of a holiday card for someone who may be in the hospital. So there's so many ways to give back, to remember your loved one that has just passed away from whatever condition or for whatever reason, to help remember them and help someone else.
Yeah, that's so important, right? And I think some of what has been shared, and certainly in the video, reaching out to people, remembering things, right? Because for many that are experiencing loss currently or have in the past, to know that somebody hasn't forgotten their loved one or them. It's just sometimes the simple note, the phone call, the text message. And since I've mentioned a little bit about the whole media piece of that, can you speak a little bit how, I know in our first video that we're talking about minimizing social media, and what might be some things from your perspective that could either be triggering, resulting in sadness, or overcommitting as it relates to social media? How do you think that could fit in?
Well, social media, I mean, if we're on whichever platform we're on, usually people are on it, they're sharing a lot of things that are happening. They're sharing the happy times. They're sharing everything they have, going well in their life for the most part. And that's a tiny snippet of of the whole picture. And so when we're constantly exposed to only people's top 2% of their, what they have going on, going well for them in their life, we start to have a very skewed view of what life should look like, and then we start judging ourselves, and it's like, where do I fit in with this? How do I measure up to the standard, which is already an inflated standard that doesn't even exist? But that becomes all that we're taking in, and that's all we have to compare ourselves to. So there's a certain part of, if we're able to limit our social media, then at least we're minimizing. We're out. If we're not on our phones or on the computer in front of the screen, hopefully we're out with people, maybe exercising a little bit more, creating new memories, but also just sort of normalizing a little bit that it's like reminding ourselves that is a very skewed perception that we're going to have if we think that that's what's normal.
I always think about families with young children, and they're trying to create the perfect holiday photo, and inevitably the 3-year-old is falling out, and my feeling on that has always been absolutely take that picture and post that picture.
Yes.
Because regardless of the memory, that is the reality. And so I think it's such an important thing to remember and share with the viewers, that it's okay to show things how they really are. If you burn the turkey, if the tree is crooked, if the menorah candles are, I mean, there's so many traditions. Some, of course, from a holiday perspective, but even just, in the New Year traditions that are coming up. The ability just to be kind of who we are, and not be afraid to show the imperfections too, and capture and that a little bit more as well.
Well, the most memorable holidays and pictures are usually the bloopers, right?
Right.
But that's what we're going to remember, and it's good.
Yeah.
You don't really remember that picture perfect holiday. I don't think I remember any picture perfect holidays, because they just become overshadowed by other other things that take your attention.
Yeah. Well, and earlier, as we were talking about, and just something fun, to think about with the viewers, how great is it to get together with a group of friends or family or coworkers after the holidays to kind of share the good, bad, and the ugly, right?
Yeah.
Because that brings about another, means of bonding and sharing too. There's going to be some, I'm sure, things of challenge, some sadness, some joy. And just knowing that you have those networks of people to share them with, really important.
Yeah.
So,
if I can just add one
please,
quick thing.
absolutely.
A lot of times, I know we talk about self-care and we talk about, how important it is to take care of ourselves. In a lot of cultures, that comes with a lot of guilt, and the idea of, what do you mean you're taking time away for yourself? So the person may experience a lot of guilt that they're supposed to just be there, and oftentimes it's the women of the family who may carry that more so than other family members. But finding a way, so whatever way that is. I know sometimes it's easy to just say oh yeah, just say no, or just turn those turn those invitations, just tell them you're not available or another time. But it's easier said than done. But if we understand that each person deserves to have their cup filled too, right? And if we can give from the overflow, so this is that piece of us allowing ourselves permission to fill our cups and to take time for ourselves. And I know a lot of times it's well, if I'm not doing anything, I'm being unproductive, then I'm a complete failure. I need to always be doing something. And it's doing nothing is also doing something. If it is recharging you and filling your cup, that's something. So having that conversation even with ourselves, and understanding it with, if we're talking to our friends and we see that they're on this go, 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 maybe having that gentle reminder of it's okay to slow down a bit. It's okay to not have to say yes to everything, and do it respectfully within the cultural norms, but
excellent.
You matter
Excellent
too.
Point.
So what I'm finding with my friends is that we all are loving our self-time. So instead of gathering, all of us are oh no, I'm tired this weekend. And so instead what we'll say is, did you see that Netflix show? So we'll just share that. So it reduces the burden, right, of having to meet up or having to do so much and be busy. And allowing it to be normal to go ahead and just lay back, put your feet up and take care of yourself, get your rest.
How great is that, right? If we could all be in the world, like you said, of free of guilt, and just say, I love you, but we'll get together another time. Right now, I just need to rest. Well, on that note, I know we had another topic we wanted to cover this evening, and certainly one that's so important, which is really focusing on substance use during the holidays. And as you mentioned earlier, this is also a time when celebrations can include alcohol, and people who are, struggle with substance use, and those that are in recovery. This can be a time where triggers can occur. So can we talk about ways that we can support individuals in our life that are in recovery, to help them to stay sober and to prevent any type of relapse? What are some tips that perhaps we can consider and certainly share with our audience this evening?
I mean, first things first is having the conversation, and acknowledging, because sometimes we may have a friend or a loved one, family member who is in recovery, and sometimes we don't know how to talk, or we don't know how to address, like, okay, the holidays are coming up, or we may not even be aware. So taking a step back and having that awareness of, like, okay, how is this going to support, or how can this hinder their recovery? And being able to have a conversation with them, and being open instead of assuming, because everybody's different, and everybody, everybody has their own recovery journey, and we want to honor that. And so if we're able to talk to them in a way where we're coming from a caring, loving, supportive stance, that we can just have a conversation and just be like, how can, if I'm hosting, for example, a house party, and someone may be coming and or if someone's hosting a house party and there's going to be alcohol, then having the conversation maybe of, like, what is this going to be a challenge, or how can we make this a better environment for you? It's not always going to be the case. That's if we're being more proactive. I know.
That you have to be really proactive, because usually the booze is in a lot of parties, and there's many people who are unaware that someone is trying to recover and stop or discontinue their substance use.
And
that's tough.
It is, and so it kind of goes on both sides. But if we're able to at least talk about it, then it's also on the person who is in recovery to make sure also that they can do certain steps to support themselves, right? So if they are going to, if they attend 12-step meetings, or they go to certain support groups, a lot of times during the holidays, they may need to go more frequently. And a lot of the support groups will actually start meeting more. They'll have more frequent meetings during the holidays to make sure that they are available, and if someone needs to make it to a meeting, that they are able to. Having a buddy. So having a buddy who is aware of the challenge, is aware of the journey as well, and can be there, who you can talk to beforehand. It's like, okay, can you please come with me to this event? And then if you see I'm about to, just make sure that I don't, go for that drink. Then at least there's an accountability person there who can support that process, who may be able to be like, hey, let's kind of head out and maybe go do something else right now to kind of prevent them from relapsing. What else?
I think what you said, is so important, because often, whatever the circumstances may be, the person, dealing with grief, or the person that's in recovery, individuals might be scared, right, to have the conversation, and they don't want to sound, insensitive, or as though they're making that person feel different than everyone else who might be an invited guest. But I think it's such an important thing to have that honest dialogue. And as you said, each person is so different. So for some individuals, they may, be hesitant because they don't want to decline and offend someone, knowing it may not be the best environment for them. And so it's giving them that permission, to say, I understand and I respect, your wishes. And for the person that is attending, having the dialogue to say, what can I do to support you in this environment, right? Or please feel free to bring a buddy, or if you have others, that you want to come with you so that you're comfortable. It's really important, just being open to meeting all of those individual needs. It's a great point, I think, that you mentioned, for sure.
And for some people, it may be that they take their own drink with them, right? Where they're like, okay, they may be at that point in their journey where at least then they're not missing out necessarily, but at the same time, they're able to kind of have that balance. But a big part of it too is role playing. So if we can practice beforehand what a response might look like, right? And we practice it so that way when we're in that situation, if someone were to ask, then it's, it's a muscle memory in a sense of we've already been able, like we already have the response ready. Instead of being put in that moment, not knowing what to say, and then not wanting to feel awkward. So maybe, giving in when we really didn't want to.
No, very, very important.
There's other ways to also just have a mocktail.
Yes.
Always ready in your hand, and that's always full, so no one questions.
Yeah, absolutely. And, when you think about, products that are available, and just whatever the person's comfort level is, right? Because I'm sure there's many audiences in which people, don't drink alcohol, or for health reasons, or all kinds of factors. And so, when people are planning to host an event, have a variety of options, right? So that everybody can feel comfortable with that. I think that's a great tip as well, especially this time of year.
Yeah.
So for our final video this evening, we'd like to hear from some people in recovery with tips on what they've had as success in planning for gatherings where alcohol will be present. So please join us here with our final video of the evening.
When I go to functions where there's drinking, I always take someone with me that knows that I'm in recovery as a support, because I'm going to tell you, no matter how much time you have clean, you can still be triggered.
I've been in recovery for 22 years, and this one has served me well. And that is to hang out at the kids' table and in the game room, playing with the kids during holiday events, keeps me away from the alcohol.
Never leave home without someone that would come and get you in your time of need. Have that one person that you can depend on, no matter what time, night or day it might be, that your stomach tells you you need to get out because it feels uncomfortable.
I like to bring my beverage to any gathering. That way, if they ask me if I'd like something to drink, I say no, I already have something.
If you're going out to celebrate with your family and friends and you're newly in recovery or you've been in recovery for a while, we suggest that you take someone with you, because the ultimate weapon for the disease of addiction is another recovering addict. Therefore, if you're in the room with your family or friends and events are starting to take place and you're starting to feel as though it's too much for you, you'll have someone there to be there as your support. Enjoy your holiday, and remember, don't take the first one.
Great. Welcome back to our final segment here of Your Health Matters OC. I want to talk about the recommendation to be of service that you've discussed tonight, Dina and Dr. CK. It seems that something that helps in all areas of things that we've covered. So when we talked about overspending, right, instead of gifts, schedule time with loved ones. And it doesn't have to be right then in that holiday moment. It can be delayed, which also helps kind of extend the joy too. Work with friends. Think about maybe service efforts, as we talked about. It's an activity that can be really rewarding and create bonds and friends. There's many populations of individuals that you can reach out to, veterans, children, individuals experiencing homelessness. There's so many different populations of people that may want the additional support this time of year. When we talk about holiday depression or anxiety, serving others is certainly a way that we can improve our outlook and focus there. And then in preventing relapse by hosting events that serve others rather yet than a party per se that might have triggering things being served. So Dina, can you validate a little bit about these resources? And I know we wanted to just talk a little bit about some of the facts and the data pieces too, particularly again around mental health and grief. And then Dr. CK will talk a little bit about the other facets of this. So Dina, I'll start with you if we could, please.
Yeah, so we know that from the time between Thanksgiving and New Year's, a lot of times there's higher expectations. People may experience more loneliness or grief and a lot of stress, and that can lead to what we, sometimes people would call the holiday blues. And that's more of a temporary thing. It may be more seasonal in that aspect. But it's important to keep in mind that if it persists beyond and if it continues to be there, that it might be the opportunity for someone to reach out for professional help.
Wonderful, wonderful. And Dr. CK, other thoughts you were wanting to share?
Yeah, so just normalizing the idea that people do tend to have either holiday blues or even exacerbations of their conditions. According to the NAMI study, it showed that 64% of people with mental illness report that the holidays actually make their conditions worse. 64%. So if someone does have a history of depression, anxiety, then just know that they are more likely to have a worsening of their condition during this time. So support that friend, that loved one, as much as you can. And according to the recent survey, they said that approximately 24% of people with diagnosed mental illness find that the holidays make their conditions a whole lot worse, and 40% make it somewhat worse. So that's still a significant portion. And we need to look after ourselves, do the right things to help ourselves through this period. But again, if you have a family, a friend that you know has this history, it's really important to check in, because there's can be so many different triggers. And we know here in Orange County, we do have a mental health crisis. We're trying to get more support out there. There are more helplines and hotlines. If you need any help getting resources, you can go to OC Navigator. You can call 211. There's so many different ways to get help.
Yeah, and our OC Links number, right? I mean, again, that immediate access and linkage, and for those seeking services, the Navigator is such a user-friendly way to easily access those supports and needs. And I think when we hear about these data, it's also important to recognize that this time of year, for individuals who we know might have that higher pressure, right, or the higher instance where they may, struggle more with things that are going on. It's okay to have a gathering or to get together or to have those kinds of connections where maybe the holiday isn't the focus, right? It's just treat it like any other time of year. And if that's going to support people with decreasing some of the anxiety and otherwise, just treat it as you would any other type of engagement with that person. Other thoughts on that, Dina, or resources that you think would be helpful for the viewers?
So thank you for highlighting OC Navigator. Of course, one of the things that we know is that when people, a lot of times if we're experiencing struggles or hardship or even sadness, even some depression, if we're able to put our focus instead of being on us internally outside, and we're able to support others and maybe be of service. So a lot of times there's volunteer opportunities. If we can gather some friends up, or even just ourselves, go and volunteer at a feeding, or wrapping gifts for maybe some of the children who maybe at hospitals that they're not doing well, or but being able to bring joy to others and support in that sense of community, that can be very helpful. And so I know that there's some of the resources are on, like for volunteer opportunities during the holiday, on our OC. I'm going to pull up. There's some through ocgov.com, which is short-term and holiday opportunities, and then also there's a long list through getconnected.unitedwayoc.org.
Great.
And also just another thing that people can think about, because I know I have my own pet at home, but there's something about having a pet, a furry animal in the house, that just reduces the stress, the anxiety, because you have someone else, some other furry friend to look after. And it may be as simple as taking a neighbor's dog for a walk, right? And just spending time with that animal, because we know that even in the hospitals, the service dogs do a great job trying to bring up the mood for people who are in the hospital and are sick.
Reducing the stress.
Right.
Absolutely.
That connecting, bonding.
Yeah.
That happens.
Well, I certainly want to thank you, Dina and Dr. CK. It's been wonderful spending time with both of you, learning about the ways to cope through the holiday season. I know that we can all take these things to heart as we move into the next month here. And for the viewers at home, our next episode of Your Health Matters OC will air on December 13th. And we'll be continuing our focus on the holidays, but we'll be focusing on holiday safety. We'll be talking with our Deputy County Health Officer about everything from common accidental injuries to driving safely. So remember, OC, your health matters, and our show focuses on talking about ways to keep you and your loved ones healthy. So thank you for watching, and we hope you have a wonderful evening. We look forward to seeing you December 13th. Good night.